Welcome to the another video of Histopathology and Cytology Techniques Unit 2 First video Cytological Procedures. 1. Collection of cytological specimens. A. Sputum. Purpose: diagnose respiratory tract infections, malignancies. Collection method: early morning deep cough sample. Collected in a sterile container. Rinse mouth with water before collection, to reduce contamination. B. Urine. Purpose: detect urothelial carcinoma and other urinary tract abnormalities. Collection method: first morning midstream urine is preferred. Collect in a clean, dry container. Send to lab immediately or refrigerate, to prevent cell degeneration. See effusion fluids, e.g., pleural, peritoneal, pericardial. Purpose: identify infections, malignancy, inflammatory conditions. Collection method: performed by a clinician, thoracentesis, paracentesis, pericardiocentesis. Collected in sterile containers with or without anticoagulants, like heparin. Processed promptly for accurate cellular morphology. D. Tissue fluids, e.g., cerebrospinal fluid, synovial fluid. Purpose: diagnose infections, inflammatory disorders, tumors. Collection method: collected under sterile conditions. CSF via lumbar puncture, synovial fluid via joint aspiration. Handle gently to preserve cells. 2. Principle and techniques of sample processing. A. Uniform smear. Spread cells evenly on the slide to avoid clumps. Enhances visibility of individual cells and their morphology. B. Thick and thin smear. Thick smear, more cells, used when cellularity is low. Thin smear, better detail of individual cells, used when sample is cellular. Choose based on sample type and clinical suspicion. See fish fail smear, also called pull or feathered smear. Technique: place a drop of sample near one end of slide, use another slide at an angle to spread the material across. Produces a gradient from thick to thin area. Good for examining morphology in varying densities. 3. Smear preparation techniques for cytological specimens. A. Sputum. Select purulent portion. Spread evenly on the slide. Air dry or fix immediately, e.g., with 95% alcohol for Papanicolaou stain. B. Urine. Centrifuge at 1500 rpm for 10 minutes. Discard supernatant, use sediment for smear. Spread on slide, fix appropriately. See effusion fluids. Centrifuge fluid sample. Prepare smear from sediment. Alternatively, cytocentrifugation can be used for better cell concentration. D. Various body fluids. Process based on type and volume. Always centrifuge if needed to concentrate cells. Smear prepared from the concentrated sediment, then fixed. MCQs. 1. Which of the following specimens is collected to detect respiratory malignancy? A. Urine. B. Sputum. C. CSF. D. Blood. Answer: B. 2. The best time to collect sputum for cytological examination is A. Afternoon. B. Evening. C. Early morning. D. Before sleep. Answer: C. 3. Which smear technique involves a gradient from thick to thin area? A. Uniform smear. B. Thick smear. C. Fish fail smear. D. Cytospin smear. Answer: C. 4. Urine for cytological analysis should be A. Last void sample. B. Early morning sample. C. Random sample. D. 24-hour collection. Answer: B. 5. What is the first step in preparing a smear from effusion fluid? A. Fixation. B. Drying. C. Centrifugation. D. Heating. Answer: C. 6. Which of the following is a method to increase cell yield in low cellularity specimens? A. Thick smear. B. Thin smear. C. Heat fixation. D. Anticoagulant addition. Answer: A. 7. A smear that has evenly distributed cells is called A. Fish fail smear. B. Uniform smear. C. Dense smear. D. Feathered smear. Answer: B. 8. Which stain is most commonly used in cytological smears? A. Hematoxylin and eosin. B. Giemsa. C. Ziehl-Neelsen. D. Papanicolaou. Answer: D. 9. What is the preferred anticoagulant for cytological fluid specimens? A. EDTA. B. Citrate. C. Heparin. D. Oxalate. Answer: C. 10. The purpose of centrifugation in cytology is to A. Remove fat. B. Concentrate cells. C. Kill bacteria. D. Increase pH. Answer: B. 11. A common method used to prepare CSF cytology smear is A. Blood smear technique. B. Needle aspiration. C. Cytospin. D. Swab smear. Answer: C. 12. Which fluid is collected via lumbar puncture? A. Pleural fluid. B. Synovial fluid. C. CSF. D. Peritoneal fluid. Answer: C. 13. Thick smears are used when A. High cell count is present. B. Sample is hemorrhagic. C. Cell count is low. D. Bacterial infection is suspected. Answer: C. 14. Synovial fluid is collected for cytology from the A. Lung. B. Abdomen. C. Joint. D. Spine. Answer: C. 15. What is the main goal of cytological smear preparation? A. Diagnose viral infections. B. Detect blood disorders. C. Examine cellular morphology. D. Identify organelles. Answer: C. 16. Which of the following fluids is collected by paracentesis? A. Pleural fluid. B. CSF. C. Peritoneal fluid. D. Synovial fluid. Answer: C. 17. An example of a tissue fluid used in cytology is A. Serum. B. CSF. C. Blood. D. Plasma. Answer: B. 18. Which smear technique is best for observing detailed cell morphology? A. Thick smear. B. Uniform smear. C. Thin smear. D. Heat fixed smear. Answer: C. 19. Which of the following is a cytological specimen from the urinary tract? A. CSF. B. Sputum. C. Urine. D. Synovial fluid. Answer: C. 20. What is the ideal fixative for Papanicolaou stain smears? A. Methanol. B. Acetone. C. 95% ethanol. D. Formalin. Answer: C. Thank you for watching. If you find the video helpful, then like, share the video, and don't forget to subscribe the channel. Hit the bell icon for latest update.